Hi, I'm Courtney Smith. I'm a PA and the owner of Grand Primary Care, a family medicine clinic in Grandville, Michigan. Have you ever wondered if you might have high blood pressure or about what a healthy blood pressure is even supposed to be? Well, let's start with some definitions. Blood pressure is the force exerted by blood onto the inside of the arteries as the heart pumps blood out to the rest of the body. It's important to try to keep the resting blood pressure in a healthy range because over time, if the blood pressure remains elevated, it can lead to really negative consequences like heart attack, stroke, congestive heart failure, kidney failure, vision loss, and even sexual dysfunction. Blood pressure can increase due to a variety of factors, some of which are not within our control. These are non-modifiable risk factors. Some examples of non-modifiable risk factors are family history, aging, gender. So up until age 65, men are at higher risk for hypertension, and then at age 65 and older, women are at higher risk for hypertension. Another example is chronic kidney disease, as well as race or ethnicity. This is kind of a complex risk factor. Asian, Black, and Hispanic ethnicities have higher risk for hypertension, and it's not clear if this is genetic or if it stems from cultural or dietary practices or from other social factors. And some risks for hypertension are within our control. These are called modifiable risk factors. Some examples of these modifiable risk factors are a lack of physical activity, a suboptimal diet. So for example, a diet that's high in sodium, high in trans or saturated fats, high in excess calories, or high in excess sugar. Being overweight or obese, drinking too much alcohol, sleep apnea, high cholesterol, diabetes, smoking and tobacco use, and excess stress. A blood pressure reading consists of two numbers, the systolic or top number and a diastolic or the lower number. Systolic blood pressure is the pressure in the arteries when the heart is beating, and diastolic pressure is the pressure in the arteries when the heart is between beats. Normal systolic blood pressure is less than 120 and a normal diastolic blood pressure is less than 80. Pre-hypertension is when the systolic number is between 120 and 129. Then stage 1 hypertension is when that systolic number creeps up to 130 over 139, or the diastolic number is between 80 and 89. And stage 2 hypertension is when the systolic pressure is 140 or greater, or when the diastolic pressure is 90 or greater. And if resting blood pressure is greater than 180 over 120, that's called hypertensive crisis. You really don't want to be in that range because there's a much higher risk of end organ damage. Blood pressure is such an important risk factor for heart disease that the American Heart Association included a normal blood pressure of less than 120 over 80 on Life's Essential 8, which are the 8 most important components of cardiovascular health. In family medicine, we spend a lot of time checking blood pressures and managing hypertension, and that's because hypertension is a common problem. The World Health Organization estimates that between 1.1 and 1.3 billion adults worldwide have hypertension, and 46% of them are unaware that they even have it. The World Health Organization also estimates that only 1 out of every 5 adults with hypertension have their blood pressure under control. So hypertension is a massive problem. The United States Preventive Services Task Force recommends that we screen adults for hypertension by checking a blood pressure reading in the doctor's office at least once a year for people who don't already have the condition, or twice a year for adults who have other risk factors for hypertension like diabetes or overweight or obesity. These screenings are very important because typically hypertension doesn't cause any symptoms, and this is why hypertension is referred to as the silent killer. So what can you do to improve your blood pressure if it's too high? There are medications that your primary care provider can prescribe. There are also several lifestyle changes that could significantly improve your blood pressure. I love this graphic from the American Heart Association that shows how big of an impact these lifestyle modifications can have on blood pressure. These lifestyle modifications include losing weight, the DASH diet, a diet low in sodium, increasing physical activity, and no more than moderate consumption of alcohol. Increasing potassium consumption isn't on this particular list, but increasing your potassium intake can improve blood pressure as well. People often ask if they need to stop drinking coffee or caffeine to improve their blood pressure, and the relationship between coffee and caffeine and blood pressure is not straightforward. It's a subject that definitely requires more research. Do you know what your blood pressure typically is? Are you worried that your blood pressure might be high and you're not sure what to do about it? Great first step is to schedule an appointment with your primary care provider. They can easily check your blood pressure, and this is a great place to start that conversation. Since hypertension is primarily a cardiovascular problem, do you need to go see a cardiologist for this? The vast majority of people, the answer is no. Your primary care provider is very capable of making this diagnosis and managing the treatment plan. You're ready to see a primary care provider who can have that conversation with you and come up with the best treatment plan for you. I would love to be your new PCP. Please visit our website, grandprimarycare.com, for information about how to schedule an appointment or submit new patient information. Like our Facebook page and follow this YouTube channel for more family medicine information. Thank you.